welcome you all to this starting solid the right way, actually. So, can I just ask you one thing? There is a term called starting solids. Okay. So, we start solid, it's not starting liquids. So, why do we start puree then? Puree is a liquid. Anybody can just tell in one line. So does it strike with you? It's always starting solid, not starting liquid. Your baby is already on liquid. So anybody wants to tell anything, it is going to be very interactive session.
Maybe because when we are afraid that, the child doesn't choke or something.
Yes, yes. Shiti, you are perfectly right. Perfectly right. This fear is what is holding us back from feeding our child in the right way. So today I'll tell you why not to fear. So, every child since the birth have a natural tendency to eat. The question is, will you allow it to bloom or control it with fear? Got it? So, since the time a baby is born, he starts breastfeeding. Baby starts breastfeeding. As soon as the baby turns 6 months, the baby is ready for solids. Already baby is liquid. So, if you give puree in a liquid form, you are taking your baby backwards in a very bad way. So, can I get a unified answer? Yes.
Yes, ma'am.
Yes.
Yes.
इतना धीरे से. Give me some energy. Yes? Yes or no? You can just tell me over, I'm not seeing chat. It's difficult for me to see chat now. I want to interact with all of you. So, yes?
Yes, ma'am.
Yes,
Perf-
definitely.
Yes, yes. So, we are not taking our kids backward. We are taking our kids forward without fear. Okay. So now coming to the most frequently asked question I get DM every day, ma'am, when to start, when to start, when to start. So today I will tell you when to start in a term baby, when to start in a preterm baby. So a baby who is born term, like after 37 completed weeks, you have to start the solid at 6 month completed, like 180 days completed. Not before that, not in the starting of the 6 month, at the end of the 6 month. Yes.
Yeah,
So
ma'am.
first point is always 6 month completed, never before that. Now this is for term baby. Now what about the baby who are born earlier? We cannot apply the same thing because they were born premature. So we have to take the corrected gestational age. Like if your baby is born 8 weeks earlier, like at 32 weeks, so you have to adjust. You don't have to, you should not start solid for preterm babies before like the baby completes the corrected gestational age. So if the baby is born 8 weeks before, you have to, there is a formula. Uh, uh, by applying that formula, we have to be very sure that baby is 180 days corrected gestational age. So the second criteria, the other criteria is now it will come. So you have to tick all of this. Tick all of this before starting solid, even if your baby is 6 months completed. And most babies don't accept solid because they are started too early or too late, or even if they are started at 6 months completed, parents have not checked for these signs because sometimes some babies may take 1 to 2 weeks extra to be ready. So what are these signs are? The baby can sit with minimal support. So you have to tick this here, a big tick. Then can So second is hold their head steady without flopping. This is a very important criteria. Never miss this point. Otherwise, there will be risk of choking. There will be risk of picky eating, and everything will be a haywire. So the first 2 point is important. Then baby has a natural reflex before 6 months that is called tongue thrust reflex. So anything put in their mouth, they try to take it out by taking out their tongue. So this is very important reflex which disappears at 6 months. So has lost tongue thrust reflex. This is very important. And when you sit and you eat food, baby shows interest in food, like watches you, yeah, reaches out to your plate. So it is very important. And last is baby can, if you see your baby playing with objects and taking it to their mouth, then you know that your baby is ready. And most of the babies are ready by at the completion of 6 months. That's why we tell that you should start at the completion of 6 months. But sometimes few babies may not be ready. So unless and until you see all this, never start. Never be in a hurry to start the solid. The main nutrition of your baby is always your breast milk till 12 months. So never be in a hurry, because if we don't start it the right way and at the right time, your baby will refuse food later. Okay, so let me tell you why not start. Some people's babies around 4 months. So people start telling that your milk is not enough. The baby is crying. Why don't you start with some barley, some Cerelac? Never do that, because baby gut is not ready. There are chances of infection. There are chances of severe allergy, and this baby may develop lifelong allergy with so many problems. And there is risk of choking because baby's head is not steady, so much steady. Baby is not ready. And these babies, when started early, they refuse food later and they become picky eater. Then there are some rituals in, like in Assam also, there is Anprasanna, rice giving ceremony. So there is a thing that for females they do in even month, and for males they do in, please correct me if I'm wrong, so they do it in a odd months. So for this, sometimes the
It is actually the
introduction of,
opposite, ma'am.
yeah, that's why I was
Yeah.
telling that something was there.
Yeah.
Okay. So because of these things, what happens that sometimes I've seen babies whose solid is not started till 8 to 9 months. So this is the biggest disaster you can do to your baby. 6 to 8 months is the critical window when your baby will be accepting food thoroughly. And if you miss this window, the baby will be a picky eater for long time. And this is same with the puree. That's why when the babies are given purees from 6 to 8 months, there is so much difficulty in transitioning them to family food or mashed food. And I've seen, I get DM and I've seen in my personal practice that people come with 2.5 month, 2.5 year old baby who is still having purees, not able to take solid food. So this is all about when your baby is ready. Checklist, why you should not start early, why you should not delay it. Told you this about this flavor window. So from 6 to 9 months, all babies are naturally very receptive to whatever you will feed the baby. Whatever you want to feed. If you want your baby to eat everything, you have to give your baby everything. And the most important mistake parents make at this time is they are very much concerned about this nutrition, the quantity of food baby should be taking, rather than what is the quality of the food. So the most important thing between 6 to 9 months is introduce as much as food you have in your basket, like your local food, your hyperlocal food, your family foods. Everything should be introduced to your baby, even if 1 spoon. Even if 1 spoon, the food should be introduced to your baby. Okay.